The United States as well will have vaccines very soon. Australia has indicated that they are able to produce millions of vaccines in their own country. And the fact that Canada does not have that capacity is completely wrong. It is directly the result of conservative governments that eliminated the capacity and liberal governments that failed to restore that capacity. And we are feeling the impact of it now with projections that we will have only enough vaccines to cover to vaccinate 3 million Canadians, not nearly enough to cover all the vulnerable populations, frontline workers, seniors, Indigenous communities. So given that reality that we are not able to produce the capacity, we don't have the capacity to produce the medication we need in our own country, we are calling on officially today the establishment of a Crown Corporation, publicly owned, so that we can manufacture our own vaccines in Canada. There is no clear plan. Who is going to receive the vaccine? What choices is this government going to make? What is the rollout going to look like? All these questions are still unanswered. The government has not provided these details, and they should. And you can look at Australia's website, and the plan is transparently there every step of the way, what's going on. The fact that Justin Trudeau and the Liberal government haven't given us a clear plan is a failure of leadership on their part. On top of that, what we're talking about today is because Liberals and Conservatives failed, one, they destroyed our capacity, and then they failed to restore our capacity to produce our own vaccines. That is directly going to mean that more people will get sick. We will have to go through this pandemic for longer. This is directly going to impact Canadians. We need to have full control over the production for Canadians of vital medication. What's being proposed, other private sources or private-public relationships will not have the same capacity to be fully focused on helping Canadians and have Canadians' interests at heart.